Hi everyone, Kate here from Cancer Rehabilitation and Lymphatic Solutions and the founder of the Bounce Back from Breast Cancer program. I wanted to show you some stretches today that will prepare you for the position that you need to be in for radiation therapy. So we're going to do some gentle stretches that will increase your range of movement, getting you ready for the position that you will be in for radiation, which I will show you. So you'll need to have your hands behind your head and you'll be resting in that position there. So you may be feeling some restricted range of movement post-surgery and also having restriction from cording, which will be another video I will show you to help release that cording. But the stretches that I show my patients here in the clinic that they can be doing are very gentle, are in the lying down position. So you can be doing these ones in bed in the morning before you get up, on the lounge room floor, or in bed at night. And so this is a really easy one, and it's using the weight of your arm plus gravity to achieve that gentle stretch. And the first one I want to show you is you just clasp your hands behind your head and your elbows are facing towards the ceiling, and then you just let your elbows fall out down to the side. And so that is creating a nice stretch through the axilla. And don't force anything down. If you are able to hold these stretches, so just say your arms come to about there, just breathe through it, a cycle of 5 breaths, and you'll find in that time that your arms will eventually fall down to the side and you'll be able to increase that shoulder range of movement, so you're actually nearly there. So the next step after that is, once you are down in that position and you've got your stretch, taking your hands out behind your head and just hold them together above your head and let your rib cage come down flat onto the floor or the bed, and take a big breath in. Breathe into the side of your rib cage and out. And just hold those stretches there, very gentle. So you are just, if you're doing this on a pillow, you're able to rest your arms on a pillow. So taking away that pressure in your shoulder joint as well. So start that one, hands clasped behind the head, and just let the elbows fall out and just relax into it. So this might take a few goes if you are experiencing shoulder restriction, but don't rush a stretch. So give yourself some time to do those stretches. The other one I wanted to show you, which is fantastic, again using the weight of your arm plus gravity to achieve that stretch. So laying down on your side, your shoulders are on top of each other, your legs are bent, so your hips are on top of each other as well. Your head is in neutral, as straight as possible. And you're going to take your arm on this side, so just say it's my right hand side, into the 9 o'clock position, as if we're looking at a clock. And so this is at 90 degrees at shoulder height. And you're just going to let your arm fall out the back. So this is called the reach out the back movement. This was shown to me by another breast cancer rehab expert, Denise Stewart. Thank you, Denise. I use this in my clinic all the time with my patients, and I can just see the increased range of movement and the stretch that they achieve. And I still get this people to do this stretch right through radiation to maintain that shoulder range of movement. So you're just using the weight of your arm plus gravity to let your shoulder fall out the back. Let your arm come out the back. And so when you get to a point of resistance, take a big couple of breaths in and out. And again, you're not forcing your arm back, you're just letting it relax. And what this particular stretch is stretching the horizontal fibers of the pec major. And so you're going to get back to a point of resistance and you want to achieve a little bit more stretch. And so pretend that your hand is up against a pane of glass, but you can't get through. But you're applying that little bit of pressure. You want to get through, but you can't get through, and then you relax. And then you achieve a little bit more movement out the back. But don't rush it, because eventually your brain will talk to your shoulder. Let it relax, and you'll achieve a little bit more stretch. And then come back down and give yourself a rest. The next position is in the 10 o'clock position. And so from this position, when you come back and reach out the back from the 10 o'clock position, you're going to get a great stretch right through the axilla and right up your arm and down into your breast and through your serratus anterior muscles. So this is a particularly good stretch because you're going to have your arms out the back in that position for radiation. So take your hand out to the 10 o'clock position, let it fall out the back. And again, when you get to that point of resistance, apply that pressure in a diagonal direction. So pretending that your hand is pushing against a plate glass window but you can't get through, and there's a little bit of pressure, and release. And you're going to get a little bit more movement out the back. And again, don't rush these stretches. And so these stretches are perfect to continue while you are doing radiation. So you increase that range of movement. You're not feeling any impingement. But if you are feeling any impingement, report this to your cancer rehab physio or occupational therapist and let them know. And so they'll be able to modify some of these stretches. And also let the technicians know at where you have radiotherapy that you're feeling any impingement within the shoulder, so they can modify your position. So if you have any questions, please leave them in comments or send me a message. If you want to see more videos, please subscribe to my channel, Bounce Back from Breast Cancer, and I'll be bringing you some more videos soon. Bye for now.